Hi, everyone. Dr. Kave live to share just how painful social media has been. Because years ago, somebody, pardon me, but ripped me a new one saying, Doctor, you can't understand pain because you've never felt pain. I was doing a video on chronic pain and the opioid pendulum, where, as you know, patients in the United States don't get the treatment and relief they need from chronic pain for many political reasons. But putting that aside, I was so offended that somebody could possibly say that I, as a doctor, all these fancy medical schools, whatever I went to, didn't understand pain. Hey, I'm an anesthesiologist. I treat pain every day with nerve blocks and medications and anesthesia. Well, obviously, that was my ego that was bruised. And that comment has stayed with me for years. And a couple others have come from others as well. And maybe their intentions were pretty nasty, but I took it to heart because pain is absolutely real, but we don't have any tools to diagnose pain or really to treat it well. Perhaps treating pain in a holistic way would be too compassionate for Western medicine or the insurance companies that run it. But, and by the way, insurance companies and modern medicine are great. I like them. I do practice Western medicine, of course, but they fall short on this. And it begs the question, do doctors and maybe insurance companies really need to feel pain to understand it? Well, I'm going to give you my story because I do believe that if someone does not understand a particular disease, they can't treat it. And I want you to learn what you can do better as a patient and what doctors can do better to treat the root causes of pain. And I hope my story will help elucidate that. And of course, we're going to do our live Q&A at the end. I want to do a couple very brief shout outs. Ringo, Patty, Big Stack, Emily, and Gabby. Jessica, good to see you on here as well. Fantastic. Jody, so many good people on here. I'm really looking forward to us tackling this challenging topic that I spent years just in my brain thinking about. And I think that I've come up with a reasonable understanding. And it starts with number one, which is, I got to say, some of my best teachers in medical school at Stanford or residency at Harvard were those that struggled themselves, or really those in my fellowship in integrative medicine. Total like 90-degree turn from anesthesia and Harvard and all that. But boy, have I loved integrative medicine. But those that had struggled, and there was one in particular with multiple sclerosis, one with addiction, multiple who had chronic pain, and even more who had failed at some point in their lives. Pain need not be physical pain, as you know. It can be from any source or any trigger. But those who had failed, either their body had failed them or they had failed somewhere in their journey, they had fascinating insights that I didn't get from textbooks, that I wouldn't have gotten without hearing their firsthand account and how that colored their association or their identity or relationship with patient suffering. As the saying goes, wisdom comes at a price, which, not to sidebar here, but this comes up all the time in my patients who are undergoing psychedelic therapies with me, because there is no cheap back door to wisdom. And being a good doctor involves wisdom. There is no cheap back door. Textbooks are fantastic, but I think that it might not be enough. Suffering is not good, to be very clear, but the results of suffering sometimes can be celebrated. If this is resonating with you at all, please let me know in the comments. I'm going to check them in just a second here as they come in live. But can we celebrate our hardships? I believe so. And I think for my teachers in particular, it's almost like a self-fulfilling prophecy thing where only those that were resilient enough to overcome the pain. I'm not saying some people are not good because they couldn't overcome it, but there's a selection bias that if someone had a particular painful experience or they failed in a hard way or their body failed them in a hard way, but they overcame that, if you will, test of strength or whatever you want to call it, well, they can now teach and share and empower others by having pushed their comfort zone. As we know, pain is at the brink of our comfort zone, right? If we're never living in pain, we're not pushing the envelope. And I learned a tremendous amount from those individuals who had overcome. Now, um, we're going to continue on here, but if you're learning and you appreciate me talking about this potential controversial topic, and I'm going to share my personal story here at the end about my struggles with pain and how it's totally changed my medical practice, do please hit that like button and share what you have learned with others. It's not about shaming people for feeling pain or not feeling pain, but recognizing that we can empower others from our personal experiences, especially if we're in a position of power and people look up to us. And if you like the private, or if you like the Q&A portion, you know that we have private Zooms. You can join our exclusive access. The link is below to take advantage of that. I promised I'd look at what people had put in the comments. No pain, no gain, says Patty. I would say no pain, no gain, but we also want to be supported when we are experiencing pain. Lori can't find a doc to give you stronger meds. And this is I believe, part of what we're talking about. If our doctors have not experienced pain, can they really understand what we're going through to treat us? And Suzette nailed it. I won't even mention pain to the doctors because I don't want to be judged as a drug seeker. How many here have felt that same fear of judgment? We just came off of a private Zoom actually with our group, and somebody specifically mentioned that. So I know it afflicts so many more patients than we're ever taught in medical school. So do doctors need to feel pain? I kind of believe yes, as you can tell. But here is the clincher. You don't need to experience the pain yourself. Because the second part of this discussion is that I believe human beings, and I'm very curious what you think, but I believe human beings can experience pain through connection with others. And honestly, this is kind of important because doctors can't experience all conditions. A doctor can't experience dementia. You wouldn't practice medicine anymore. If you've experienced life-threatening cancer, well, you may not be long enough to ever practice medicine. So there's some conditions that we simply cannot experience, at least for very long, and be a healer. So perhaps through empathy and observation and connection, and oh my gosh, the word compassion, which I feel never comes up in Western medicine, perhaps we can experience pain and suffering by walking a mile in another person's shoes. Guys, this has been said for over 100 years. This is not me saying this. This ain't new. But can we experience immense suffering from those around us? Yeah, I believe so. And my personal experience, I believe, has led me to I feel a better doctor. Since that jerk on social media lambasted me about not being able to treat pain because I didn't understand pain. Big Stack here is talking about his wife with fibromyalgia, and I'm sure she understands pain, and I hope that her healers do. And I'm with Tanya on this. I think that docs who can truly engage with empathy can experience pain, not the exact same pain. And Jake Jody says, just sit with them. So what did I do? What has my experience been? And then we'll get to more of your comments here because they are fascinating on this really important topic. When I developed chronic pain, holy guacamole, did my understanding change about pain not being, of course, like it's not the same. Pardon, I have something in my eye. The beauties of being live, right? It's not the same pain that my patients feel. Of course not. But gosh, it's like waking up every day in this little nagging thing. It's like I wouldn't have appreciated what patients go through with this everyday nagging sensation until I felt it. It's bizarre that it's hard to remember pain viscerally, though I believe some patients perhaps can. Most I find cannot. But that really changed my interaction with individuals with pain. When a very close, very, very close friend of mine nearly took their life, it ripped a hole in my understanding of depression and PTSD. And I can tell you I have never been the same since, especially in treating my patients, whether it's in surgery, whether it's with ketamine, but having that appreciation. Now, I didn't have to be the one going through that, thankfully, but being there with them along the journey in a mindful way, not just like, hey, how are you doing and checking in, but sitting down with them like that comment was a moment ago. Another one for me personally was being gaslit by another doctor in a position of power over me. I mean, having my sanity questioned by someone who was like my boss kind of thing just blew my mind about the effects it had, a ripple down effect, a trickle down of like so many elements of my core identity and how I function, how I treated patients over this gaslighting. When patients now tell me that their doctors gaslight them, the power differential between one doctor to another perhaps is this much, but between a doctor and a patient might be like tremendously more. It might be orders of magnitude more. So now when patients tell me they've been gaslit, I got to say, I have a whole different view. PTSD, another one that I had a freak accident that happened to me. Details don't matter here, but boy, did I struggle with like something that I would always tell patients, oh, forgiveness, giving up hope for a better past. I would say this, and it made sense to me intellectually, but it took for me an experience where something absolutely out of left field happened. And I was like, whew. I'm not here to share my personal history, but it might be the closest I've ever come to experiencing a traumatic experience. Now, fortunately, it was not true PTSD. I had the right support around me to prevent a traumatic experience from turning into PTSD. But for the days and weeks after, I even furthermore now, I've had a connection with patients who've experienced, of course, not the same type of trauma, but this forgiveness concept has never rung more true. And I feel like when I can look in someone's eye and appreciate how challenging it is to give up hope for a better past. Once again, not all pain is physical tissue destruction pain, but sometimes the psychological pain or emotional pain can make tissue destruction pain worse. And being able to understand how hard it is to embrace these powerful concepts of forgiveness. Not impossible, it's not victimizing. But I don't know if there's a way that we can truly connect with patients unless we have had it firsthand or very close secondhand experience. This is about changing the situations. I don't want to pity patients. I don't want to eviscerate the remaining empowerment that some of my patients have, but I want to increase their power and help them change their situations because that is what's going to heal them. It's when patients have a purpose, when healers have a purpose, that we will be able to heal, whether it's healing others or healing ourselves. And as you know, you have more power over your health than you've ever been told. But it's hard to access that innate healing capacity unless you are with a healer or you are empowered by a healer or by something else to uncover that healing capacity. And that level of empathy and connection, as much as I love my medical training, was lost on me. Maybe I was a bad student. Maybe I just didn't get it. It's a possibility. But by golly, it wasn't until experiencing, and sometimes it sucked a lot and it was painful, but I believe fundamentally that there is not a cheap back door to gaining that wisdom. It does come at a price. And if we cannot wallow in self-pity and frustration, but rather celebrate what we learned to empower others, we can be better healers for others and take better care of ourselves. So I'm going to jump into your comments here. If you learned something new, please hit that like button and subscribe to keep up with all my lives. Consider joining that exclusive access so we can have more private Zooms if that's what you appreciate and asking me more personalized questions. Gene, pain is the single most human experience. Yeah, I agree. Susan, if doctors could have my pain, they think twice about how they treat patients. Susan, we don't want to inflict pain on others, but I agree that it's not until someone experiences what you're going through that they can better understand. My heart goes out to you. I'm a bone cancer survivor of over 36 years, Mallard the Duck. Well, aside from having an amazing username, I am sorry that you had that. And I hope that somewhere along the way, you've had a healer who has maybe had a close enough experience with that pain to be able to connect with you and to give you the healing that you deserve. Donna, medical students aren't taught to heal, they are taught to medicate and keep patients coming back. Well, Donna, I don't want to throw everyone under that bus, but I would agree that that is kind of the ethos in Western medicine. It's not exclusively, I mean, it's not all or nothing here, but yeah, you're right. Bumblebee, doctors don't listen when you're in pain. Once again, I don't want to throw all doctors under the bus, but I think many doctors, because we don't have good tools, we don't have the right time, we don't have good diagnostics for pain, we try to kick the can down the road and do a temporary Band-Aid. Has that been your experience? I'm sure others here have. Can you talk about compassion a bit and how it's helped you? Nicole, compassion is so important to differentiate from victimizing. Because compassion is being able to sit down at eye level with the patient, maybe hold their hand, maybe touch their knee or their shoulder, whatever, a non-creepy way. But to be able to connect, saying, I'm a human being like you. I want to help you feel better. I don't know when the last time was a human being did that to me. I mean, fortunately, it has happened. I have loved ones in my life. Yeah, but in a professional setting, when was the last time a doctor did that? I don't know if there's a pill. What do you guys think? I don't believe Xanax. I don't believe hydrocodone. I don't believe, maybe ketamine is the closest thing, but I don't believe that we can have a substitute for that level of human connection and compassion. Not about, oh, poor patient. Oh, you need so much being taken care of. That can encroach on it can encroach onto gaslighting eventually. It can encroach onto I know better than you, a kind of an arrogance, right? Arrogance and compassion are very different, obviously, or even coddling, I should say, and compassion, right? Doctors, I don't think, should be coddlers. Does everyone know the difference between coddling and compassion? I hope that answers your question there, Nicole, about compassion and why we need so much more of it, not coddling. The 15-minute patient in and out needs to stop. Yeah, KV, I agree. And Gabby, that is so incredibly nice of you. Thank you. Jennifer, I wish more doctors and hospital staff learn the difference between normal PTSD and medical trauma PTSD. Oh my gosh. Medical PTSD is like having a sickness and then being allergic to the medication, right? It is just so darn challenging. And then, it's even worse because, to your point, Jennifer, you have the illness, you're allergic to the medication, and the doctors don't know that you're allergic to it. So they're giving you the same medication and you're having more allergic responses and they're stuck. So Jennifer, my heart goes out to you. I hope that you are feeling more empowered to speak out and to advocate for yourself. Adam, oh my gosh, Adam, thank you so much for the super thanks. I have a severe hiatal hernia where almost all of my tamash is in my chest. I think you mean stomach, right? The hiatal hernia is a herniation of the stomach through the diaphragm, like you're saying. But my chest told me that I shouldn't be in pain because the problem is inside my body and not on the outside. Adam, hiatal hernias are very challenging. I'm sorry that you've been working to heal from this. Hiatal hernias can be very painful because they can predispose to acid reflux. They can predispose to esophageal cancer if they're untreated. They can have so many conditions, shortness of breath, etc. Is it going to be, yes, your doctor is perhaps right that there are not the same types of nerve endings inside our body as there are outside our body, but to disqualify the perception of pain altogether is not helpful. It's not productive. I'm sorry that you had to go through that. And I'm curious if anyone else here has ever, I know you're not alone. I'll bet you will see a bunch of comments coming in a moment here about people's pain perceptions being blown off. Mary is saying, is it unreasonable for patients to expect no pain? Yeah, I think it is unreasonable because I think the human condition is pain. It is also unreasonable for doctors to not treat pain in however way they can safely. So I hope that approaches the balance that Western medicine needs to better embrace. My current PCP was in an accident several years ago. She had to have rods placed. I think she understands my scoliosis pain better than me. Well, I mean, case in point here, nobody wants suffering inflicted on other people. And hopefully we can prevent others from having to undergo that type of painful suffering by connecting with them so that we can take better care of others. Coddling versus compassion, Jody, this is really important. I got it. It was Stomach Adam, by the way. We're good. I got it. Thank you for the super thanks again. But Jody's point, compassion is more of a one-way street. Pardon me. Compassion is a two-way street. It's like, you want to do this? Let me help you do what you want to do. If I can teach you, let me teach you. Maybe you can teach me back. That's compassion. Coddling is a one-way street, Jody. It's like, I know what's right for you. Let me show you how to do it. It's a little bit of almost arrogance. It's not the compassion that we're talking about here that often is an important component of the healing relationship. Now, in some cases, when a patient's under anesthesia and they're unconscious and paralyzed and connected to a ventilator, well, yes, I am the one who is doing one-way life support for the patient or managing the life support. So yes, it's not like it's never appropriate per se, but in most medical interactions, the compassion is going to be more prominent or should be more prominent than the coddling. I'm sure you all agree with that. I wish hospital staff would stop triggering my PTSD. I was attacked and they keep touching me. I want to go back to my trauma. I had a patient once receiving a treatment. I mean, just to how real this is, they were receiving something in their IV from me that caused a little bit of discomfort in their body. That medication triggered their visceral PTSD. And it had been the first time I'd heard someone have such a sensitivity to a trigger, but I don't doubt that it's real. It is more real than I ever knew. Insha, I am from India and I want to become an anesthesiologist. Can you please suggest I have a lot of videos on anesthesia. I recommend you watch them. I'm wishing you the best in your journey to be a doctor. Heather, good to see you. Thank you so much for for that kind comment. Talk to anyone who has had their epidural fail during a C-section. Wow. This one's quite rare, but I've heard once, the way it was described to me is that the anesthesiologist who was there had never heard a human being yell so loud in their life. That's all I can say. I hope that didn't happen to you, but that's absolutely, absolutely tragic. I haven't found a doctor who doesn't help. Should have found all major issues. I don't trust them. Okay. I have not found a doctor who does not help. Susan, this is like double negatives here. You kind of got me thinking. I hope that you ultimately will find a doctor that does help. I'm trying to put together the logic on the fly right now. Different isn't necessarily less. I agree. And yes, kidney stones are absolutely challenging. I hope that they've improved now, Donna. Straight talk. We'll watch back. Oh, I hope you learned something new from this. Ginger and Snap. I'm in the middle of figuring out my gut and brain. And I found some things that help in the moment. Well, I'm grateful that you have. And as you know, the gut and brain are connected by, the vagus nerve is like the direct highway between your brainstem directly to your gut. And the vagus nerve is bidirectional. There's afferents and efferents, meaning there's nerves that are sending information from the gut to the brainstem and nerves that are sending information from the brainstem down to the gut. So it's rather fascinating how conserved over millions of years of different mammals that has worked its way into biology. Absolutely insane. The super chat is churning my own stomach in sympathy. Wow, Emily, I'm with you. I have an umbilical hernia that I can't have operated on until I finish up this round of chemo and radiation. Well, Emily, I'm wishing you the best in this round of chemo and radiation. I hope that your empathy with others here, and I believe in karma to an extent, and I believe that if someone puts out that positive energy, it returns, perhaps because it helps us. If nothing else, it helps take us out of our own body and helps us gain a broader perspective. Perhaps that is a synonymous view of karma. Helping us walk in another person's shoes benefits ourselves as much as the other person. I hope that other people can connect with that. As an American female, if I were going to have a child, I'd choose to give birth just about anywhere but the US. Well, I'm sorry. I'm sorry. I've been in hundreds of L&Ds. I've seen many positive births happen in the United States. I can appreciate that some people have had negative experiences. I mean, good to see you for your first life here. I hope you're learning something new. Do I know what bacterial arm is? Yeah, if you mean the syndrome in children, yes. I don't know what the arm stands for, but bacterial is if I remember it, vertebral body. R was radius, L was limb, R was rectum. I don't remember all of them. I don't do pediatric anesthesia anymore. Anyway, Gerald is digging into the memory banks here. Let's do 2 more questions here. Oh my gosh, so many great comments, and I appreciate everyone being so vulnerable on here. Susan, painkillers, I am explained, will they defeat the purpose? I'm not following Susan, sorry. I look a bit tired. Hope you get enough sleep. Thank you so much, Josephine, for your concern. And anorectal malformation, Gerald. Thank you. Thank you for letting me know that. We'll end with Brittany. Sorry, I haven't been watching your live here recently. Been dealing with a lot of mental issues. No need to be sorry at all, Brittany. I'm wishing you the best, Brittany, in what you're working to heal from. I hope everyone here is sending you positive healing energy as well. And with Shirley, thank you, Fizzboot. The book title. I don't know what you're talking about. Is this the book that you want me to write? I'm working on it. Guys, until next time, please remember, you have more power over your health than you've ever been told. And if you learn something new, please share what you learned with others to help empower them. You probably all have more power, like we said, over your healing if you can uncover your healing capacity.